So thank you very much for the invitation. And I would like to talk about hybrid imaging and not only hybrid imaging, but also I will talk about multimodality, which is probably a broader term that also covers hybrid imaging. First of all, why the hybrid imaging is so important, especially in medicine? It's due to the nature of diseases, various diseases, including cancer. Please take a look at the quotation by John Leaf, who emphasized that cancer is much more intelligent than previously thought. It behaves like an organ. It can impact defense mechanisms of our body, impact microenvironment, and this is how it develops. So if the cancer behaves like an organism, it's like a group of soldiers, rebel soldiers, rebel cells. Each of the cells is of different nature. So why do we have such heterogeneity? There are different theories. One is the clonal theory, so cells are mutated and there are cells that will be immune to specific types of treatment, and a clone, a cell clone, will become non-sensitive to our actions, and then the disease will develop, although some drastic treatment therapy can be started. There is another theory that is closer to me. It's a closer on some cells. There are cells that are important to cancer stems. These are stem cells. They are more immune to chemotherapy, and they become the foundation for the development of the oncological disease. It's all interrelated with a story going back to Darwin. In 1844, he wrote that species are not non-variable. They do undergo variations and changes. The same applies to cancer cells. They are transforming from normal to pathological cells during carcinogenesis. They adapt to the environment. They create metastasis. So the statement by Darwin is a general theory and principle in the environment of the live cells. I would like to focus to attract your attention to this slide. Dr. Gleason, the best doctor in London of the 18th century, he joined the soul with the body. So when he was treating the body, he was treating the soul, and vice versa. And he only had the hand. So he was checking the pulse, and based on this, he was making diagnosis, and he had to implement global treatment for the whole body. Now our approach to medicine is different. We use various methods, including imaging methods. Any imaging method is based on a specific physical phenomenon. So we can observe a process applying to the specific nature for the specific image. So here you can see these beautiful, slim, long legs. Probably they will be perceived differently if we use a different keyhole of a different shape. It would be a completely different image. So which imaging methods are available? Of course, we use the methods that are related to detection of X-rays. This is a very famous image of Madame Röntgen with her wedding ring. A follow-up was radiological studies, tests, such as CT scans. That is the first CT scanner. At present, even the basic hospital apparatus can perform the exams which use various reconstructions to obtain the atlas, anatomical atlas of the specific patients. Becquerel, several months later, 6 or 9 months later, he discovered that X-radiation is not only artificial radiation that can be developed by artificial methods, but it's also present in nature. It was just an interesting discovery by Becquerel. So it was a small observation that was expanded by a woman. So he informed Maria Curie-Skłodowska, who developed a new science that provided the basis to nuclear medicine. This is only a house in Warsaw where Maria Curie-Skłodowska was born. So you can see a beautiful mural that is of historical nature right now because the museum has been renovated recently. And this slide is dedicated to all young scientists. The first Nobel Prize was defended by Maria Curie-Skłodowska in the same year. So my wish to our young colleague is that the time between your PhD exam to Nobel Prize award should not be any longer than 2 years. I think 2 years is enough to make such achievements. So then there were another 50 years to develop practical implementation in imaging. This is Hall O. Anger, who constructed the first gamma camera, and before there was Benedict Cassen, who constructed a scintigraph. So the differences between these two apparatus do not have to be explained to you. So the consequence was the nuclear medicine that provides imaging of various types of organs and diseases. So radiopharmaceuticals are not only simple compounds, chemical compounds used in examination of heart or lungs, but it can also be used for leukocytes, cells, erythrocytes, you know, the exam with labeled lymphocytes to detect some lesions in abdomen. I should also mention sonography, ultrasonography, and the magnetic resonance. These are the heroes of this technique. So there is a whole range of exams of potential. But I would like to attract your attentions to what many authors stated in their papers. Although there are so many different imaging modalities, none of these modalities is perfect and sufficient to obtain the information for the disease process. So, hybrid imaging, I would like to stress two main goals of this methodology. So first of all, we want to improve the quality of the images. Please take a look at these two images. They can be interpreted differently It's simpler, it's easier to interpret the image on the left-hand side than on the right-hand side. And then the second goal is to provide a better characterization of the lesions. So it's a different perspective from different points of view at the disease. I have mentioned these keyholes, different aspects of perceiving diseases and their processes. But joining morphological image with the activity image is of key importance. So this is important for the nuclear medicine. Imaging of morphology asks for imaging of function and vice versa. And there is a quote in German: morphology without function is just a dead body, while the function without morphology is also a useless soul only. So 1 + 1 in imaging medicine is not 2, it's 3 or maybe even more. So the idea of hybrid imaging is quite an old story. I found this image. So this is a radiological image of a patient. So there is a scintigraphy of the liver, and the physician was trying to identify the location of the abscess near the liver. So this idea was formulated in 1953. It was called anatomometabolic imaging. This term it's not become very popular, and we seldom use it in its original version. However, the idea is still alive. The first devices used for hybrid imaging were the devices combining CT with SPECT gamma camera used for radioisotope exams. So Blank and Spohr group announced the first studies on the use of this new idea. So these authors used the CT exam to correct absorption. So this device was not just used to characterize the lesions, but also to improve the quality of imaging. So that's the idea I have already mentioned. In 1999, there was the first generation of commercially SPECT CT devices. So their characteristics was that unfortunately the CT device was not perfect. It was 2 or 3 row device, and the quality of the imaging was not sufficient. Further development was about development of CT systems. Now we use 64 or 128 rows. And of course, nuclear medicine has developed. So the heads, gamma cameras heads have also been developed. So what's the clinical application of SPECT CT system?
So let us speak about the differences between these two concepts. So actually the first application is to be found in oncology and neurology. Today, radiology without imaging, hybrid imaging, seems hard to be imagined. The first example is a skeletal scintigraphy. So this is the commonly used examination, which is very sensitive. We know that the bone changes appear not only in oncological diseases, but also in case of inflammations, metastases, or trauma. So when we observe just a single lesion and a single parameter, is hard to be interpreted properly based on the images. The SPECT three-dimension image helps us to diagnose the patient, but when it is combined together with CT, it significantly improves diagnostic accuracy. And this is a good methodology for us when we run diagnostic examination. These are the examples of such types of exams. You can see morphological changes in case of inflammation of the hip bone. So we can see the inflammation process here clearly. And here, this is mandibular dysplasia that has been clearly shown here, and you can see the increases in the bone. And another example, this is mandibular hypertrophy, and here, due to hybrid imaging, we can accurately locate the bone changes and the lesion location. So only such hybrid imaging enables us to properly assess the active centers. Today, we should get rid of whole body examination. In fact, this type of examination should be exchanged by a three-dimensional SPECT examination, tomography, that should be combined with CT. Only the combination of these two methods provides us with a much better diagnostic of the better diagnostic accuracy. What the whole body SPECT CT scintigraphy allowed us? Actually, the hybrid methodology shows to be much different in the numbers, as you can see here. So when we speak about diagnostics in oncology, in case of SPECT, only 52 examinations were not accurate. Once SPECT CT was introduced, the number got reduced to 4 examinations that were not accurate or specific enough. So it clearly shows that the role of hybrid examination is much better. It allows us to accurately assess, diagnose the functions and morphology of the tissue. And here we can see the similar rule. Only one SPECT CT is introduced. The authors have found out that in case of 400 patients, the specificity is over 0.9. So actually, this is not a new research. It was done 10 or 5 years ago. So actually, when the methodology of hybrid nature started to be applied, we noticed that this type of examination is much more accurate. Moreover, what I like here is the use of SUV measurements based on SPECT CT examination. Here you can see the images of the bones with use of different technologies, and given the current state of art of software and hardware, we can see that this is really identical. So the argumentation that we can use SUV measurement in PET examination is no longer valid, because in case of SPECT, we can use the same idea. So the SUV values do not vary much from PET examination. That's why I'm in favor, definitely in SPECT CT, whole body examination, instead of whole body PET examination without the use of computer tomography. We are now waiting of the examination of gamma camera that will allow us for this type of examination. Ladies and gentlemen, given this one single example, I would like to draw your attention to one more element. This is strictly financial element of the whole examination. So let's say we have 100 patients that should be examined, and 15% of the patients will show that the image is not detailed enough, and we would have to provide a special PET examination for these 15% of patients. But as you can see, the cost of SPECT CT is much lower compared to PET examinations. And we do not have to actually use very costly PET examination for 100 patients, but only for these 15% of the patients whose images were not clear enough. And now another example, thyroid cancer. It seems that without SPECT CT hybrid examination, it will be hard for us to interpret the images in order to determine iode presence, the dynamics of which is not very favorable for gamma cameras. Of course, these examinations have their own constraints, like technical constraints. However, they are very helpful in order to determine the stage of the disease. The authors emphasize that SPECT CT imaging in case of thyroid cancer plays a very important role in proposing a proper treatment, regardless of the stage of the cancer. And SPECT CT methodology seems to be the proper tool to identify lesions. Here we have a patient that has been described by Professor Hassan in 2015. This is a papillary carcinoma in a 49-year-old female, and the authors emphasize that SPECT-C images demonstrate much more provide much more information when we compare it with the scintigraphic examination only. Another example from the same group, well, ladies and gentlemen, these data shows that the number of results is dramatically higher. And now I would like to sum up this group. So it seems that the utility of SPECT CT imaging has positively influenced the treatment approach in 85% of the patients compared to non-hybrid examination. So it shows that SPECT CT definitely increases the proper examination. SPECT CT is also used in case of children that suffer from the same cancer, and definitely the combination of SPECT CT gives us much better results. Another example is the use of meta-iodobenzyl guanethidide scintigraphy. And here I have in mind some specific diseases that occur in children. And actually, in 2003, at the very start of use of SPECT-CT, showed that in pediatric patients, it helped to elucidate physiologic tracer uptake in the right ventricle, sometimes misinterpreted. That was sometimes misinterpreted. And actually, it shows that SPECT-CT detected additional lesions in 22% of the patients. It helped to localize lesions much better in 21% of the patients. It also resolved some suspicious findings in 85% of the patients, etc. So no doubt that the hybrid examination is of high importance. And two more examples of examinations of children suffering from neuroblastoma. And here we have an example of a 6-year-old child with newly diagnosed neuroblastoma. However, it was hard to localize the lesion. Only SPECT-CT imaging allowed us to localize the primary lesion near the bone. And here another example that you can see in the two other pictures. And last but not least, I would like to emphasize the role of SPECT-CT in sentinel node. It is very important in oncology. Actually, the detection of lymphatic metastatic involvement is very important in the staging, in prognosis and treatment of various cancers. And we can determine whether the sentinel lymph node is the first lymph node, or whereas it spreads, or whether it is localized in only one location. And here you can see that the sentinel node can be located in very different locations in the organism. And here you can see the images that show sentinel nodes. And a surgeon can really very precisely locate the node when he has or she has such an image. And SPECT-CT can be applied in non-malignant diseases as well. So, for instance, in osteomaosteoitis, adenoma. Actually, now we cannot imagine applying scintigraphy without SPECT-CT. In fact, SPECT-CT allows us to get rid of ventilation examination of lungs. So if there are any anatomic changes in lungs, allow us to determine that the lack of flow of blood is caused by a specific problem. So I would like to conclude my lecture now, this part of the lecture at least. So, for the majority of applications, SPECT-CT methodology plays a significant role. And when we apply different data, and in one of the articles, Israel O. in 2019 said that the SPECT-CT imaging is of high importance, and actually what Aristotle said, the axiom is formulated by the Greek philosopher that the whole is greater than the sum of its parts. And it also, this saying actually applies to SPECT-CT methodology. Here you can see gamma camera close to SPECT-CT apparatus. However, we need to remember that SPECT is not the only type of imaging, and actually PET is another type of examination, and today we cannot imagine applying PET without computer tomography in standard care of oncological patients. Actually, this concept of combining these two methods actually was developed in the 90s when Townsend and his co-workers developed a first prototype that was operational in 1998. And actually the idea itself was developed much, much earlier in 1984. And it was published, it was not publicized, but it was developed by researchers in Japan. The first commercial PET-CT equipment was developed in 2001. And this is the image of the first PET apparatus. And the authors of the first apparatus tried to add morphology and at least to draw the shape of the patient. And using this first apparatus, more than 3,000 examinations, 4,000 examinations of brain were performed. So these are the first prototypes of hybrid cameras from 1990s. Well, the first anatomo-functional examination is not to be compared with the current technologies. Development of PET-CT technology has helped us to increase the accuracy of diagnosis and staging and restaging of various cancers. So we, at the very beginning, we could see that this type of examination plays an essential role, especially PET-CT technology was found very useful in cancer of head, neck, thyroid gland. Actually, the scope of the examinations has expanded over time, but now PET examination is not applied without computer tomography anymore. Here, we can see that due to PET-CT, we can get the sensitivity of 94% in lesions and the specificity of 97%. In 2003, when this methodology was applied, the number of unsuccessful thoracotomies was reduced by 41%. And in Germany, National Health Service managed to save a lot of money by introducing this new methodology. And here we can see some examples of prostate cancers and the staging before treatment. Here we have the example of lymphoma, and you can see that this is very precisely located. And what is really important now, in my opinion, is the use PET-CT technique in monitoring the treatment. The technique of PERSIST could be RCIST could be replaced by PERSIST technique. So we could actually follow the changes when the treatment has already started. So here you can see the lymphoma before and during treatment, and it proved very useful when the courses of chemotherapy were applied. So you can see here that we can really save a lot, not only in terms of money, but also in terms of pharmaceuticals applied.
So these are examples of recurrence of the cancer. PET MRI was a huge challenge. PET CT was a marriage where everything is agreed, but PET and magnetic resonance is a marriage of love. And marriages of love very often face successes and failures. And you need to take care of such marriages and you need to protect them. So let's consider why PET magnetic resonance is so important. MRI facilitates good assessment of morphological changes in soft tissue. So the combination of PET and MRI provides us with more information. The resonance also facilitates the use of functional sequences and diffusion studies. So in combination with PET exam, it expands the diagnostic possibilities of the device. The idea was started even earlier. In the 1990s, it was considered to combine PET with MRI. So the first combination was called the tandem, when first the PET exam was conducted and then the resonance. And currently we use the devices where these two systems are integrated in one device. This slide shows you where PET MRI is located in the time scale. So this method was accepted in, let's say, 2010, 2011 by FDA. But resonance, PET and magnetic resonance also involves some difficulties, which correspond with the attenuation phenomenon, correction of absorption, and the effect of ionizing radiation on the photomultiplier systems. These issues has been resolved quite early. I will just remind the rule, the idea of the photomultiplier in the device. So now we have very good devices of this type. PET MR, will it replace PET CT? Why not? PET MR indicates a huge potential to replace PET CT, but as I have mentioned, there are also some limitations. So probably PET CT will be like a driving engine in the diagnostic imaging. And PET MRE will be used for selected diseases. There is another quotation on the limited use of this technique, at least currently, but we don't know what will happen in future. I would like to show you the number of papers on PET CT, this marriage based on reason. And I would also like to show you the number of publications on PET MRI. First, the interest was quite low, and now the interest in this technology is increasing. So maybe the love marriage will even provide us with more benefits. Which exams can be provided by PET MR? First of all, oncological exams, then the brain exams, and other cardiological and pediatric exams. The share of pediatric exams is very important because thanks to this application we have a smaller radiation, ionizing radiation dose to young children. And when we look at the tumor lesions, the prostate cancer, brain cancer, lung neuroendocrine cancers dominate. To end my presentation, I have 5 minutes to go. I would like to say that the hybrid imaging is not just PET CT, MRI, SPECT CT. The hybrid can also mean some other techniques. So I have only mentioned the PEARL. I would like to stress that in this Vermeer's picture there is a lot of more than the PEARL. So here you can see the combination between EEG and fMRI. It's a new tool to examine brain function. So the electrodes are applied, then the MRI was performed, and during this exam we managed to identify the source of epilepsy. So it was the gating magnetic resonance. So the idea is to start the system several seconds after the needle appears in the records. I would also like to mention another group of contrasts, hyperpolarizing contrasts. So this is the device we were using sometime. We were using for some time. It is used to hyperpolize some chemical compounds. So the group of these compounds that can be hyperpolarized is quite large, so the contrast is administered intravenously, and the spectroscopy of magnetic resonance is performed. And Pyrogronian's so here you can see the metabolic pathway of pyruvates. So we are watching the peak for lactates when it comes to tumors. So this is finally, we can say that this is the hybrid exam. So the peak for the lactates in the healthy prostate at the initial stage of tumor development, and here you can see the malignant lesion. The level of advancement, the level of progression of disease can be assessed using this method. This is another example on brain tumors, so you can assess the level of advancement of the disease. Another example of monitoring mammary tumor. So you can see before and after the use of oxyfen, you can see the falling concentration of lactates. So this example shows that this method is comparable to the exam performed by PET. So you can use different markers, Pyrogronians and so you administer a tracer marker and you can check the perfusion, pH. So it's very important information. And these pictures are very sentimental to me. They go back to the past. I would like to also emphasize the role of contrast agents, hybrid contrast agents. The present contrast agents can be labeled using different substances, such as the quantum can include an element of ion and something to facilitate optic imaging. So we can see this can also apply to radioisotopic labeling and optical labeling. So the difference between two elements is that radioisotope stays for quite a while the optical imaging just presents the moment of joining the ligand with the receptor. Another example of the use of hybrid contrast agent, and again, I have to say one of my last slides. So I would like to present to you the idea of the radio-guided surgery, where the radioisotope methods are combined with the methods to provide very detailed analysis and the location of the lesions. So to sum up, hybrid imaging has revolutionized diagnostics, and currently we cannot operate without this technique. Hybrid imaging allows us to individualize the diagnostics. That is, we can individualize therapy for the patients. So there are both inter and individual differences in the course of diseases. And the biggest difficulty and limitation of the methods is to bring up a new generation of physicians and technicians. So we have to change, we have to learn how to use both these techniques, and we have to use both these techniques, and we have to assess both these methods together. I think that it's only thanks to the hybrid methods, hybrid imaging, such terms presented by these authors, unclear medicine, well, it has changed the sequence of the letters, and so from unclear medicine, our specialization has become nuclear medicine that offers a lot benefits to medicine, especially when we compare this time to the times when hybrid imaging started. Thank you for listening to my presentation.